All right. Good afternoon, everyone. On behalf of Flagler Cares and One Voice for Volusia, thank you for attending the Health and Human Services Summit this year. My name is Carrie Baird, and I'll be the moderator for this session. The session you've joined is titled Best Practices in Telehealth. All of the participants are going to be muted during this session, and we'll have a Q&A time at the end of the session where you can raise your hands and I'll unmute you, or you can add your questions to the chat session. If you have requested CEUs for this session, we do ask you to keep your camera on during the session. Want to take a moment to thank all of our sponsors for the event today: Advent Health, Career Source, Flagler Volusia, SMA Healthcare, Magellan Complete Care, Department of Children and Families, and the House Next Door. It's my pleasure to introduce your trainer for this session, Heather May.
Thank you. I'm Heather. I am a clinical supervisor at the House Next Door at our Deltona site. And so we've been using telehealth throughout this pandemic. And so I just want to be able to communicate those best practices and give everyone an idea. There's some things that may seem really simple, but are kind of easy to forget because they're so simple. And so kind of just covering different aspects of that. All right. I'm going to go ahead and share my screen for the PowerPoint and so first off, we have the definition of telehealth. And so the use of electronic information and telecommunication technologies to provide what the client and the provider, or when the provider are not in the same place at the same time. And so the use of synchronous, so that is the technology, the meeting happening at the same time, as well as asynchronous, so that's other types of communications that are not happening for the people communicating at the same time. The telecommunications technology by a telehealth provider, and to provide the healthcare services, including but not limited to assessment, diagnosis, consultation, treatment, and monitoring of the patient. I'm actually gonna exit out of this because it's not letting me see the whole thing. There we go. And so transfer of medical data, patient and professional health related education, public health services, and health administration. The term does not include audio only telephone calls, email messages, or facsimile transmission. So those are not included in the definition of telehealth. And a telehealth provider is any individual who provides healthcare and related services using telehealth and who is licensed or certified, who is licensed under a multi-state healthcare licensure compact of which Florida is a member state, or who is registered under and complies with the subsection 4. So the Florida state statutes, a telehealth provider has the duty to practice in a manner consistent with their scope of practice and the prevailing professional standard of practice for a telehealth professional who provides in-person healthcare services to patients in this state. So telehealth essentially does not allow us to do more than we would be doing with our clients and our patients than we would be doing if they were in office. It just allows for that alternate method of meeting with them and kind of increasing the ability to communicate and get in contact with people who may not have resources to meet in person. A telehealth provider may use the telehealth platform to perform a patient evaluation. If a telehealth provider conducts a patient evaluation sufficient to diagnose and treat the patient, the telehealth provider is not required to research a patient's medical history or conduct a physical examination of the patient before using telehealth to provide healthcare services to the patient. So again, if they're able to get the information appropriate through telehealth, then an in-person meeting is, or gathering of other resources is not necessary. A telehealth provider and a patient may be in separate locations when the telehealth is used to provide healthcare services to the patient. And a non-physical telehealth provider using telehealth and acting within their relevant scope of practice as established by Florida law or rule is not in violation of those statutes. Again, some of those statutes, depending on the type of service you're providing, maybe more specific as to where the client is located and where the provider is located. So as a mental health counselor, I am licensed in the state of Florida. Thus, I cannot provide services outside of the state of Florida. So that is if I am outside of the state of Florida, as well as if the client or patient is outside of the state of Florida. So keeping those things in mind is really important as well. And so HIPAA can be one of the biggest challenges when it comes to telehealth. So the Health Insurance Portability and Accountability Act of 1996, HIPAA, the HIPAA privacy rule for the first time created national standards to protect individuals' medical records and other personal health information. So it gives patients more control over their health information. It sets the boundaries on the use and release of health records. It established the appropriate safeguards that healthcare providers and others must achieve to protect the privacy of the health information. It holds violators accountable with civil and criminal penalties that can be imposed if they violate the patient's privacy rights. And it strikes a balance when public responsibility supports disclosure of some forms of data, for example, to protect public health. So kind of just setting that up, it is important to keep any HIPAA regulations in mind when using telehealth, mostly for that protection of the patient's privacy, which, as we know, when we're online, there's a lot more access to that information. Only you and your personal representative has the right to access your records. A healthcare provider or health plan may send copies of your records to another provider or health plan only as needed for treatment or payment or with the patient permission. The privacy rule does not require the healthcare provider or health plan to share information with other providers or plans. And HIPAA gives you important rights to access your medical records and to keep your information private. So being HIPAA compliant is our responsibility when it comes to the HIPAA agreement. As a professional, being HIPAA compliant means that you have satisfied the elements of the security rule. You have policies and procedures in place and you're adhering to them. You are knowledgeable in HIPAA as it relates to your business, and you are adamant about documentation. So we want platforms to not only for us ourselves to be compliant with HIPAA, but for platforms to be compatible with HIPAA so that we're able to adhere to all of these compliance standards. So a checklist for successful HIPAA compliance. So some things to keep in mind and to make sure that you have are implemented written policies, procedures, and standards of conduct, designating a compliance officer and committee, conducting effective training and education, developing effective lines of communication, conducting internal monitoring and auditing, enforcing standards through well-publicized disciplinary guidelines, and responding promptly to detected offenses and undertaking corrective action. So we've obviously had the COVID-19 pandemic for over a year now and have experienced a lot of challenges when it comes to providing services to patients. Some positives to that were loosened restrictions on the usage of platforms. And so it gave, in that emergency, it gave us the ability to provide services through platforms that were not originally or to the standard of being HIPAA compliant and compatible. Since then, the state of Florida has ended that emergency mandate, allowing the usage of the following programs. So for certain video chat applications like Apple FaceTime, Facebook Messenger, Google Hangouts, Zoom, and Skype, as well as text-based applications such as Jabber, Facebook Messenger, Google Hangouts, WhatsApp, and iMessage. And so some of those platforms do have HIPAA compliant and compatible options. However, they're free or certain paid versions are no longer a part of that. And so it's really important to make sure whatever platform that you're using, that it is both HIPAA compliant and compatible. For best practices, it's really important to set the stage. You may want to have someone available during the virtual visit who can provide or obtain additional tech support if needed. When it comes to internet connections, to issues with the platform, to issues on the patient's side of connection, Having alternative options to reach the patient, such as phone, email, text, in case something goes down or is wrong, has also proved essential. I actually had an example of that this week where we logged on, we could see each other, but there was no sound. So being able to make that phone call to the patient and kind of troubleshoot the issue and see if there was a way around that was really helpful. It is also important to access the patient's to assess the patient's familiarity with telehealth and provide orientation as needed before the virtual encounter. So if you know that they don't have great access to online platforms or are just less familiar with those types of things, you may want to orient them a little bit to what to expect. When a link or a message comes through for them to join the telehealth session, that they are able to kind of differentiate that from other types of messages and emails and links that they might be getting. So explaining why you are using telemedicine. So for example, to keep patients safe, to keep patients and providers safe, especially during the pandemic, to provide better access, easier access to those medical and mental health services, and to improve the patient convenience. So, not having to worry about transportation, taking extra time, anytime we're having to move to a different location, it's going to take a lot of things into consideration. So that convenience can really help a lot of people gain access to services they might not have otherwise. And assuring patients that the telehealth visit is secure and will not appear online. A lot of people can be very uncomfortable with the internet, with anything being communicated or conveyed across internet spaces. And so them understanding how those platforms work and that information is not going to be shared, that it is only accessed by those who are inside the session, can kind of put some of that at ease. So you can consider giving patients a telehealth checklist to help them better understand the process, set expectations, and prepare appropriately on their end. So there's a few examples of things that you might include on that. So testing the equipment before the telehealth visit, so making sure their computer or other device is able to connect to the platform, making sure that their internet connection is good. If they have technical difficulties, to call the following number and providing them with an alternate means of contact, whether that's your email, your phone number, so that they can call and follow up if there's any issues on their end, or again, send an email. Recommending that they find a quiet place for the virtual visit, because people are not in those very created environments of our offices that are intended to be calm and private. In whatever environment they're in, they may not automatically have that space, and it may not occur to them ahead of time to set that up. So giving them that recommendation that they can find somewhere quiet and private to log in and participate is really helpful, or knowing that that might not be something that they have access to, and so how to work around that. Ensuring adequate lighting to allow for session. Again, the video aspect is very important. The phone only or any without video is not going to be accepted as telehealth. And having a pen to write down assignments or questions. So again, sometimes the communication back and forth can be challenging. There can be the application freezing, or the connection just not being great. And so going back and forth can be not the best at times. And so being able to have them write down questions or assignments, that way when those things happen, they're able to come back and refer to whatever they need in order to keep that session going. Your video presence. So while using video, having an adequate front lighting makes it easier for the patient to see your face clearly, but be careful to avoid glare. So sometimes very direct lighting is not actually as helpful as we might think, but making sure if you can see yourself very well in the camera, then odds are they can as well. And adjusting the camera so that you fill the screen, and trying not to have anything between you and the camera. For example, a desk, a table, Sometimes that's necessary depending on the environment that you're in or the service that you're providing, but a lot of times just having that camera fixed on you is best way to operate that. Remembering that looking at the camera achieves the eye contact with the patient that we might have in person. So it can be easy to look at their face on the screen. Sometimes we're distracted by other things on the screen. I know for me, it can be hard to not focus sometimes on myself and think like, I didn't realize my hair was doing that, or something else going on. And so making sure that you're focused on the camera will help the patient to feel like that you're engaged with them and seeing them. The interaction will also be more natural if you use facial gestures and body language fitting for the conversation. So things that you might normally do in person are also acceptable in telehealth. So leaning in and nodding when appropriate. And then picture in picture also helps you to monitor how you are coming across. But again, try not to fixate on yourself. It can be challenging. It can be a little bit distracting when we're not used to having to see ourselves and how we're coming across. But again, that can be a really helpful tool to see, what do my facial expressions look like? Do I feel like I'm conveying what I'm attempting to convey? And kind of having that little check-in with yourself. Choosing a neutral background free of anything that may shift the patient's attention away from you is helpful. So a lot of people use bookcases, a blank wall, a tapestry, something like that to minimize the amount of things that are going on in the background, and again, distractions. Also avoiding busy patterned clothing or fidgety behavior that may distract the patient. And you should dress professionally. Consider wearing your name badge or other means of identification. And in essence, you want to keep the same professional attire that you would use in other clinical settings. So making sure that the way that you would behave in an office and in that professional setting is going to translate into the telehealth as well. You want to prepare by reviewing the client's chart in advance. Sometimes if it's in an assessment, there's not already a chart to review, but reviewing any referrals or information that's been provided to you prior to the client's session. And doing that will minimize the need to have to look up the information during the encounter, which can break the perceived connection. Minimizing background noise. Again, some people really enjoy having white noise machines or things to kind of dull out some of the other background noises. As much as we can be in control of that. And turning off other applications and notifications on your phone and computer. Those can be very distracting. I know some people have watches that also do that. So there's great do not disturb functions and things like that that help to minimize the distractions for us as the providers. And you want to give the client your undivided attention. I think with telehealth, that can be really challenging when we're in the same space as someone. I think it's a lot easier to be present and to have that connection and more minimal distractions. But when we're online, there's a lot of things popping up. And so minimizing those things and really being able to focus just on the telehealth is going to give, as close to that real life experience as we can. So additionally, you want to start by introducing yourself and acknowledging the patient and anyone else who may be with them. Confirm that you can see the client and that they can see and hear you as well. Speaking slowly, clearly, and pausing for potential lags in transmission is also incredibly helpful. There's often time lags, and so you may find that you're speaking over each other at certain times. I find it really helpful to just acknowledge that and acknowledge that there can be some challenges with the telehealth platforms and the internet connections, and thus, we may find ourselves accidentally talking over each other, and that's okay. And we'll keep trying to work on minimizing that as we learn each other and learn the platform. If anyone else is with them, it's also important to make sure, again, coming back to HIPAA, that we are compliant and making sure that there is a release or an authorization to have someone else present for whatever service is being provided, if necessary. taking notes or looking up information during a virtual visit may require additional explanation to keep the client engaged. If I know I'm going to be taking a lot of notes or I'm going to be typing a lot, for example, in an assessment, then I'm going to let them know that I'm going to be typing. I may be looking down or off to the side, but I want you to know that I am listening, and I will do my best to keep, as often as possible, looking at the camera and checking in and making sure that they know that I'm engaged and I'm listening, so that they stay engaged and participating as well. And trying to address any technical issues that arise with composure, patience, and humor. I'm a big fan of humor. I find that that kind of can take the edge of the stress off. And again, I use that a lot, especially with the lags, that sometimes we're going to talk over each other. I know you're not being disrespectful. I hope you know I'm not being disrespectful, that we can, take those things again with a little bit of patience. And so telemedicine requires some new techniques. However, the main principles of client-centered communication still applies. So oftentimes these platforms will have screen sharing or polls or questions or different options to help engage the client as well as kind of some creativity in how to transfer some of the things that we might be doing in an office onto the telehealth platform. I will often send worksheets or handouts ahead of time so that they have time to review that, and that we can both pull that up in the session if necessary and kind of facilitate some of those discussions. Asking clients about their goals, preferences, and priorities at the start of the telemedicine visit can be really helpful to get their perspective and get to know what they're looking for out of the visit. Doing so is a great way to build rapport and ensures that the virtual encounter focuses on the client's needs. So kind of meeting them where they are, being able to kind of have them as the expert of themselves and us as the expert of the service that we're providing. Practicing active listening by summarizing what clients say and verbally reflecting on their statements is really helpful. Again, with telehealth, it can be really challenging to stay engaged. We don't have all of the things that we have when we're in person with someone. And so we want to kind of work extra hard at making sure that there is that back and forth communication, that they see that we are fully engaged with them. And giving people space to be heard conveys respect and caring. So using open-ended language and inviting questions. So again, it's a bit of a dance there between providing those responses and also allowing the space for them to be sharing what information that they have. All right. So here, just to kind of review that some of the benefits to telehealth patient engagement is greater access, greater efficiency, and safety. Those things have been incredibly important over the last year or more. And so setting the stage, your video presence and communication are very important to make sure that, when we don't have access to see people in person, that we're still providing the best services that we possibly can. So with regards to records, a telehealth provider shall document in the patient's medical record the healthcare services rendered using telehealth according to the same standards as used for in-person services. So medical records, including video, audio, electronic, or other records generated as a result of providing such services, are confidential pursuant to the statutes. So the record keeping does not change across whether you're in person or using telehealth services. However, it is important to acknowledge what type of service was provided. So was it in person, was it telehealth? And make sure that that is clearly documented. And there are certainly some barriers to telehealth. For anyone who had to kind of jump into using telehealth pretty quickly in the last year, it's really not been easy. There's been a lot of those barriers and a lot of creativity in having to work around those things. So limitations with performing comprehensive evaluations, possibilities for technical difficulties, security breaches, and regulatory barriers. Again, with engaging maybe younger patients and clients, that can be challenging over telehealth. They can be easily distracted. They can be interested in other things going on. Sometimes they're very focused just on their own picture. And so it can be really hard to perform those comprehensive evaluations when we have technical difficulties or our clients are just struggling to stay fully engaged. Some critics of telehealth worry that telehealth may adversely affect continuity of care, arguing that online interactions are impersonal and dangerous, and that the virtual provider does not have the benefit of a complete history and ability to provide a safe environment for the client. And there's definitely something to that. I think there's some ways to minimize the likelihood of that. And, I guess that kind of comes into the discussion of is it better to have some services rather than none? And that's a really tricky question to answer. So it really allows us to have access and to have our clients have access in ways that they wouldn't have before. But safety is certainly another aspect of that. They might be safe from any person-to-person transfer of germs and anything like that. However, are they in a safe environment to address the concerns that they have, or do they have the privacy and the confidentiality to share whatever they are intending to share with us? So there's definitely some considerations to be had with regards to the barriers. Telehealth also faces many legal and regulatory hurdles, including large variations in rules, regulations, and guidelines for practice. The variability contributes to the confusion for providers engaged in the practice of telehealth. Trying to make sure that you're following every rule and stipulation can be challenging. There's a lot of information out there, and it can be hard to make sure all of the T's are crossed and I's are dotted. Providers should keep risk management strategies in mind and familiarize themselves with potential telehealth risks and implications. And this will ensure that best practices for patient care are being used and to avoid licensure and litigation issues. Telehealth rules and regulations vary greatly by state and are constantly emerging and evolving. This creates unclear understandings regarding standards and guidelines among healthcare organizations and groups. And the rapid expansion of telehealth, especially during the COVID-19 pandemic, paired with variable regulations and guidelines, creates increased potential for liability and legal issues. Again, towards the beginning of the pandemic and for many, many months afterwards, a lot of the regulations and guidelines were really relaxed, and very necessarily so, to allow the access to the services as much as possible. However, those things, they change pretty quickly. And so having to adjust to those changes with little notice can provide very challenging for the providers and thus for the clients and patients as well. So providers having the awareness of and maintain compliance with state and federal legal requirements while using best practice guidelines to provide patient safety. So benefits of telehealth, because there are many. It is limiting physical contact, and that reduces everyone's exposure to COVID-19. We've got a lot more moving in a positive direction with vaccinations and other methods of reducing the likelihood of transmission. And so it allows us to have that ability to kind of go back and forth. Should we need to use telehealth in an emergency, we have that option. Whereas only having in-person services really limits when suddenly things change, and things change very quickly in our world. Visiting virtually can address issues wherever patients are, even from the comfort of the home. And that can help us to have access to a lot more patients who, for one reason or another, are maybe not able to get out of that environment, or feel more comfortable and safe to engage in services from that environment, who might not seek out services otherwise. Staying put cuts down on commuting, travel in bad weather, time off from work, and need for childcare. So again, it kind of allows a little bit more freedom in some of the areas for the provider as well as the client. Using virtual healthcare tools can shorten wait times to see a provider and expand the range of access to specialists who live far away. There are a ton of specialties that can be really challenging to find someone in the area locally when patients don't have a lot of access to resources. It will at times allow them access to specialists who they might not have been able to see. And although virtual visits may not be as common as traditional in-person appointments, there are many benefits that explain why this type of care is growing in popularity. Increasingly, telehealth technologies are being adopted and implemented as an efficient and cost-effective means for delivering and accessing quality healthcare services and outcomes. So again, just kind of a new way to do things, a new way to add on to what we're already doing that's, hopefully pretty successful, and just reaching as many people as possible. Telehealth provides access to resources and care for patients in rural areas or areas with provider shortages. It improves efficiency without higher net costs, reduces patient travel and wait times, and allows for comparable or improved quality of care. That one, I think it can kind of be a little bit different person to person. Hopefully comparable is our standard there, and improved even better. And better access to care, convenience, and reduced stress with telehealth use also can increase patient satisfaction. So I have a couple of videos, so I will pull these up. Right, I think I have to share the other screen. Right.
We can't hear the volume. Can you hear it on your side, Heather?
I can.
I had a session earlier that had to play their video in a different way in Zoom than they had in the past.
Okay, let me try taking out my headphones. Can you still hear me?
I can hear you.
Okay.
Aloha. The purpose of this video is to give you some basic tips about how to conduct a telehealth session using best practices. First, let's talk about your environment. What is behind you when you're on camera? It's best to have no doors and windows behind you, as they can be distracting for patients and could cause an interrupted session. A blank wall that is a neutral matte color works best. If you have any shelves visible, make sure they are not cluttered. You can always pull a screen or curtain across a door or wall to hide what's behind it. We want your surroundings to look professional. How is your lighting? Make sure what is seen on camera is well lit. No one wants to see a shadowy figure giving them information. Use extra table lights if necessary, since fluorescent overhead lights are not flattering. Try not to have a window or other light source directly behind you, as it will cause you to be backlit and make it difficult to see your face. How is your equipment set up? Just like an in-person visit, it's good to make as much eye contact as possible during a telehealth session. To simulate this, you may have to raise your laptop, tablet, or monitor with some books so that the webcam is positioned around eye level. Before each session, make sure that your face is relatively centered within the screen so that the patient is not just seeing the top half of your head. You may also want to use a noise-canceling headset if there might be any ambient noise around you. If there is a chance that someone might walk into your room while you are doing sessions, remember to put a sign on the door to not enter. Try to reduce sounds from others, including children, pets, cell phones, and other distractions as much as possible. It's always good to look professional, especially on camera. Limit wearing patterns as they can be distracting. Don't wear noisy, big jewelry, and check to see if there is any glare off your glasses. Many people who do telehealth also wear a lab coat during appointments. Much like an in-person appointment, please do not drink or eat during sessions. If you are going to be using your mobile phone or a tablet, make sure you are not holding your device in your hand as you will appear shaky to the patient. Do not move or walk around with your device to avoid having your head bob around. It's best to use a stand to make sure that you're stable within the video. Now, let's talk about patient interaction. Since most telehealth sessions are with people you have not met, make sure to introduce yourself and the purpose of the appointment. Some providers even put a sign on the wall behind them with their name. Then make sure to have the patient introduce themselves and tell you if there's anyone else in the room with them. Sometimes you can't see who else is off camera. Make sure the patient can see and hear you well. Ask them at the start of the session. Adjust the camera to maximize eye contact. Whether you're new at this, have done a lot of telehealth previously, or just logged out of this system an hour ago, before you start a new set of sessions, you should always test your connection to the platform. Make sure your internet connection, microphone, and video are working. It's better to troubleshoot before you're on with a patient than during a session. Ending the session. Remember to reiterate your recommendations to the patient and provide documentation for your records and the patient as needed. If you can, try to give the patient information about who to contact if they have additional questions. Finally, check that you've successfully logged out of the session completely.
I have one more.
I don't feel good.
There we go.
I'll call the doctor.
Yes, Mrs. Jetson, somebody got a pain in the tummy tum-tum?
This is the future we were promised. But like jetpacks and flying cars, virtual doctor's visits have mostly been the realm of science fiction. That is, until the COVID-19 pandemic. As in-person doctor's visits grew risky, regulators acted to temporarily remove barriers preventing greater use of telehealth. With millions of Americans taking advantage, the past few months have ushered in a grand experiment in the nation's healthcare system. The big question is, what will happen when the virus goes away?
Telehealth is a way for doctors and patients to communicate virtually from home. So your doctor should be able to diagnose and treat you to a certain extent. But there are some roadblocks when it comes to telehealth.
For patients, the appeal of not having to leave your house to talk to a doctor is obvious. And doctors like the efficiency and flexibility telehealth provides. A match made in heaven, right? It's not that simple. The lack of widespread use of telehealth before coronavirus largely came down to two things: privacy and money. Let's tackle privacy first. Anyone who's visited a doctor's office and signed those forms about how their information will be used knows about HIPAA, the Health Insurance Portability and Accountability Act.
Everybody here?
Signed into law in 1996 by President Bill Clinton, HIPAA was later amended to allow patients access to their health data.
Telehealth comes into play when we're talking about data protection. So the privacy and security rules is basically what marries telehealth to HIPAA.
HIPAA requires that health providers and insurers protect patients' data. It also requires that electronic health information is secure when transferred online. As a result, companies looking to do business with healthcare providers must enter into official contracts. These business associate agreements require tech companies to adhere to the same patient data protection and security standards as doctors. But for many doctors, even using approved platforms hasn't been worth the risk.
Doctors have been a little bit hesitant to try telemedicine when it comes to regulatory red tape around HIPAA. If they make one single HIPAA violation, they can be hit with fees per year up to $1.8 million.
Which brings us to the second barrier to widespread telehealth: money, specifically insurance money. Until the pandemic, Medicare and Medicaid wouldn't pay health providers for telehealth services except for rural patients and those with rare conditions. Private insurers tended to follow suit.
Doctors wanted to try telehealth for a while, and they weren't getting reimbursed in the way that they would if they were doing in-person visits.
Then came COVID-19. Amid concerns over the safety of visiting a doctor's office, the Department of Health and Human Services eased many of the rules that prevented widespread use of telehealth.
Today, we're also announcing a dramatic expansion of our Medicare telehealth services.
HHS's Office for Civil Rights said in March that doctors could use non-public facing applications. They basically said, we won't hit you with penalties if you need to talk to your patients this way.
Regulators also made it easier for doctors to be paid the same for virtual visits as for in-person visits. And nearly every state relaxed licensing requirements during the pandemic, making it easier for doctors to treat patients online without first establishing an in-person relationship. In many cases, doctors are now even allowed to treat patients across state lines. With regulatory barriers out of the way and an eager public, telehealth has boomed during the pandemic. The week before national stay-at-home orders were put in place, Medicare reported 11,000 people used telehealth services. A month later, in the throes of the pandemic, visits were up to 1.3 million for the week, a staggering 12,000% increase. The big question is, what happens next? In theory, the HHS allowances end when the pandemic does, but regulators have hinted that some elements of telehealth are likely to stay in place.
Healthcare industry experts are expecting for telehealth to continue, and not only continue, but really boom. Regulators want this. HHS wants this. Patients want this. Doctors want this. For once, especially in healthcare, everybody is on the same team.
This might finally be the moment when our virtual doctor science fiction becomes reality. Now, about those jetpacks.
All right, so I have some resources. So telehealth information through hhs.gov, floridahealthsource.gov. We have HIPAA for health professionals, Harvard Law Medical School's Trends in Medicine, as well as the U.S. National Library of Medicine. So it seems like questions and comments.
Do you want me to, I can go ahead and allow everybody to unmute themselves if they have questions. Are there any questions for Heather? You can put them in the chat or unmute yourself. Well, I have a question. Have you done telehealth where it's facility to professional rather than home to professional?
So you're saying like the patient is at a facility?
Right, like the patient comes to see you, but they need a psychiatric visit. So you, would telehealth to get a psychiatrist appointment.
I haven't done that before. Typically, what my role would be most often is with the helping them contact. So I've definitely done where I've, allowed them to in the office, make the phone call, try to set that up if I'm not sending a direct referral. So I've had things like that where we're working together to get them access to that. But I guess my concern with that would be, could that be considered double billing of, if I'm billing for their time and then they're spending time with another provider, that could get a little murky.
Right.
So I think you'd have to know where that line would lie.
Right. I understand too, that Department of Education has a different view on telehealth, and that even if you have, like, say, a school mental health provider who wants to talk to a kiddo that's on home instruct, there has to be an adult at home with that student before the telehealth visit can happen. Is that similar in other fields of work, or if you're doing Medicaid billable, do you have to have an adult present when a minor is doing telehealth?
So I know for us, under 16, yes, or anyone with anyone under 18 with any like significant risks. So if there's high risk for safety concerns, high risk behaviors, things like that, then we do require a parent or guardian. They can have, if the parent wants to sign a release or caregiver wants to sign a release for another adult to be there, they can certainly do that. And so we do require that if they're over 16 without those safety concerns or safety risks, we don't require that an adult is present, but that it's a little hard. It's kind of case by case basis, and we want to be able to address any safety needs in the moment. I don't expect, just think with mental health specifically, you don't always know what button something is going to push. And so, if I have a 12-year-old and they're not really showing signs of any concern, but then we kind of touch on a topic that they dysregulate in response to, we want to have someone there as essentially backup. They need support and to know that they're safe and they have someone to help them regulate, help them calm down. So that's kind of my greatest concern. I don't know exactly if within the school system, if they're addressing, different issues that might be a little triggering like that. But definitely for us, that's part of that, is not just the access, because it's nice when people can access and not have to work around all those barriers, but definitely making sure that essentially kids aren't responsible for things that they wouldn't normally be responsible or shouldn't have to be, which can be sometimes regulating their own emotions.
Thank you, I appreciate it.
Mm-hmm.
Are there any other questions for Heather? All right, great. Well, Heather, thank you so much for presenting today. And thank you everyone for participating. Since we're ending early, there are a few sessions that start at, or there are 3 sessions that start at 2 o'clock. So I will add to the chat a link directly back to the system, so that you can select another session if you'd like. And I will also add our event evaluation, if you don't mind taking just a couple minutes and letting us know what you've thought of the event today. Gotta get back to the right screen. I'll add that as well. It's a SurveyMonkey. Thank you very much for being here.
Thank you so much, Carrie.
Thank you, Heather.